Hello friends, welcome to this chat about mitochondria and the electron transport chain and also the role of deuterium in causing or in the causation of chronic diseases. When we talk about chronic diseases, many a times we are talking about energy depletion or disorders of energy depletion. Let's think about the mitochondria. Mitochondria eats what is left behind the cellular metabolism, where the cell converts glucose into either pyruvate or lactate. Pyruvate can easily enter the mitochondria. And also there is a small issue why this conversion happens one way or other, either as pyruvate or as lactate. When there is enough oxygen, then the cellular metabolism tends to produce more pyruvate. And when there is less oxygen, then lactate is given preference over pyruvate. So once this pyruvate is made, then this pyruvate can enter inside can gain entry inside the mitochondria, and it could be converted into a lot of energy molecules, such as NADH and FADH2, along with other production of amino acids and other byproducts. So we are talking about NADH and FADH2, the most important energy byproducts of the citric acid cycle, and there it is. But there is one small fly in the ointment, and that is the body cannot use NADH or FADH2 as such, but these must be converted into ATP. So what happens inside the mitochondria? The mitochondria has in the inner mitochondrial membrane certain proteins, complex 1 to 5, which can take in one or both of these molecules, FADH2 and NADH, and using the electrons so liberated from these charged molecules and pump hydrogen ions outside the membrane. This will come back into the inner space of the mitochondria through what we call the complex 5 or ATP synthase, which is in effect a nanomotor. When, like in a regular turbine in a dam, when water runs through it, the turbine turns. Likewise, when protons come back into the inner mitochondrial space, the protons will turn this turbine, and in doing so, it will help phosphorylate ADP into ATP. As I mentioned earlier, the protons makes this whole process work. Proton has a specific size, and this ATP synthase has a space that will sort of fit the protons like hand in glove. So That's what the body expects, protons. But when a deuterium, which is twice in size and twice as heavy, comes through, it sometimes rips the nanomotors of this fine mechanism, and it can damage it, harming the whole electron transport chain. The body knows that there are deuterium out there, and one every so many molecules, 1 in 6,000 molecules or so, are deuterium. So this information has made the body adjust for it, so that some destruction of these nanomotors of the ATP synthase is expected. It is okay in normal life when we are healthy, but in the case of a person who is already compromised, their energy production mechanisms is not functioning properly. And in this case, when a deuterium molecule comes through this nanomotor of ATP synthase, it can damage it. And so in an already compromised person, it creates a lot more problem. It's like you're sitting at the edge of a wall, and a tiny pressure will make you fall. Likewise, this is already a compromised person. They are barely surviving, and then when the energy production is even compromised further, the disease process proceeds at a faster pace. So what do we do in such a condition? We could, using certain techniques, some hacks, you can reduce the damage to ATP synthase. How can we do it? The easiest, simplest, and the most common sense way of addressing such an issue is to give water with lower number of deuterium, so much so that the lesser damage can help the body heal faster. How can we get this? Low deuterium water, or it's called deuterium depleted water. Deuterium depleted water is available online for sale or from other sources, and once a person is taking more of a deuterium depleted water in their diet, that could help the person have lesser number of damages inside the mitochondria. What else can you do in such a situation? The simplest answer, other than having deuterium depleted diet, is to have more fat in the diet. Why? Because when glucose goes through the citric acid cycle, for 1 cup of glucose, 1 cup of deuterium free water is produced inside the mitochondria. But when it is fat, for 1 cup of fat, the mitochondria makes a lot more ATP in terms, as well as 1.5 cup of pure H2O with no deuterium in it, and that can power the body's most vital needs. Also, it reduces the number of damage inside the whole body. Thanks for watching, and hopefully I can come back with another story like this, and hopefully you will find some help from what I present here. Have a great day.